नमस्कार दोस्तों, मैं डॉक्टर संजोग मेकेवार। आई एम एन इंटरवेंशनल स्पाइन एंड पेन फिजिशियन एंड ऑल्सो द डायरेक्टर ऑफ जीविशा स्पाइन पेन एंड रीजनरेटिव हॉस्पिटल। तो दोस्तों, आज के इस वीडियो में हम बात करेंगे हार्मोनल थेरेपी फॉर ट्रीटमेंट ऑफ वीक बोन्स और ऑस्टियोपोरोसिस। ऑस्टियोपोरोसिस, जैसे कि हमने देखा हमारे पिछले वीडियो में, इट इज बेसिकली कंडीशन वेयर देयर इज डिक्रीज्ड मिनरलाइजेशन ऑफ द बोन, या बोन्स आपकी बहुत ज़्यादा पोरस हो जाती है बिकॉज ऑफ द डिक्रीज्ड डेंसिटी ऑफ द बोन। ऐसे सिचुएशंस में देयर आर डिफरेंट टाइप्स ऑफ ट्रीटमेंट्स विच आर अवेलेबल, एंड टुडे वी विल स्पेसिफिकली टॉक अबाउट the hormonal therapies which are used when the density of your bone is very poor, and the condition which is called as osteopenia or osteoporosis. So before starting any kind of hormonal therapy, we generally do a DEXA scan of the patient and we try to find out how much weak are your bones. तो जब भी आप DEXA scan कराते हैं, वहाँ पे एक T score और Z score करके results आते हैं. And basically what are these? We compare the density of the patient with the normal patient of the same age group, and we try to find out how much weak are the bones. तो जनरली आप DEXA स्कैन का रिपोर्ट देखेंगे तो वहाँ पे आपको स्कोर्स या रेंजेस दिखाई जाएगी, लाइक 0 to -1, -1 to 2.5, more less than 2.5, -2.5. So these are the various ranges, or which will tell you a different story. These are the different ranges according to which you have to interpret your results. So if your DEXA scan is within the range of 0 to -1, then generally the patient is having normal density of the bone, and we don't have to give any therapeutic medications to these patients. But if the patient's score comes between -1 to -2.5, then the interpretation is that the bone mineral density is decreased for that patient, but it is not that severe, like the bones are not too much porous. The fracture risk is not that much, but the medications or the treatment has to be started in these kind of patients. ऐसे patients जिनको osteopenia है, जिनका score -1 to -2.5 है, ऐसे patients में generally we start the patient on calcium and vitamin D supplements, and we generally give these patients calcitonin nasal sprays, which are in the form of nasal puffs, which have to be taken daily for at least 3 to 6 months along with these calcium and vitamin D supplements. Now, if the patient's score is less than -2.5, that denotes that the patient's mineral density is very poor and the patient is suffering from osteoporosis. ऐसे situation में the patients are started on hormonal therapies like the parathyroid hormone injections. Now, parathyroid hormone is a natural hormone which is present in our body and which helps in the activity of the osteoblasts in our body. So, with the help of these parathyroid hormone injections, we try to activate the osteoblasts of your body, and we try to initiate the new bone formation. Now, along with this PTH injections, we also give patients 6 monthly injections of Denosumab, which is a kind of an immunoglobulin which inhibits the actions of your osteoclast cells. So, with the help of PTH hormones, we are increasing the mineral density, we are increasing the bone formation. So, with the PTH injections, we are increasing the bone formation, and with Denosumab, we are decreasing the bone resorption, and hence ultimately we are helping increasing the bone mineral density. So these are some of the hormonal therapies which are used in the patients of osteoporosis. So I hope this video helps you understand what kind of therapies are available for weak bones called as osteoporosis. And if you are happy with the videos, please subscribe to our channel. And if you have any queries, any doubts, you can ask in the chat section. We'll be very happy to answer your queries. Thank you.